So we understand that one of the big things that you're concerned with is the finances behind all of this. It does cost money to get this done, and we want to try and help you as you're trying to decide how to answer this question, how to make the decision, who am I going to go with when you already know that this is something that you really want to do. The purpose of our discussion today is to help you compare apples to apples, because there's a lot out there on the market and it's not all the same. And what we feel we've done here at Revive Dental Implant Center is built a system that allows us to give you all the best, but not at the highest cost. And we want to explain a little bit more what we mean by that.
When you come into the office, you'll be meeting with me first. And one of the things that we'll talk about is how not all teeth are created equal. Not all, whatever's fabricated in the office that you may be considering is not automatically comparable everywhere. We know that there's people out there making final teeth in plastic. We know there's people out there that are making other types of materials that we don't feel strongly should be used as final teeth. And so the price may reflect that. And so we made a decision early on that we weren't going to play that game. We are going to make permanent, strong teeth, regardless of what the cost is that we're able to provide for our patients, so that we can provide you the best. And we don't want to change that.
One of the values of having both your restorative doctor, your surgical doctor, and the lab under one roof is the cost savings, okay? There are significant cost savings that get passed on to you as the patient. Think of it this way. If you were to come to us, but we weren't going to do your surgery or your lab work, we're going to have to find another person to do those things. We have to find a surgeon, we have to find another lab. And that means you're essentially paying 3 different people to get the same work done that you're going to get done at Revive Dental Implant Center by paying just one business to get that same product.
In conjunction with that, there's the aspect of the clinical side of things, the time that it takes to sit in the chair and get the work done, the time it takes to have the lab work done. Because it's all under one roof, we're able to kind of combine certain things to make it more efficient. It allows us to be able to plan the treatment and actually physically make things in a more efficient manner that will save you time and in essence save you money in the long run. There's very few instances or scenarios that we haven't seen. We've seen the most complex, we've seen the most simple, we've seen everything in between. There's not something that we're going to see that is going to really surprise us. Because of that, we know how to handle these situations, we know how to handle them effectively, efficiently, in a timely manner, and we're able to.
One of the goals that we've had at Revive Dental Implant Center is to provide a very high quality but at competitive rates. And we've been able to do that because as specialists, we can be efficient with each of our appointments and we can make the decisions that need to be made to get you the highest quality, but we've also adopted a lot of technology. So we're not reducing the price of treatment by cutting corners or doing a lesser thing. We're keeping everything very high. We have very high standards here, but we're reducing the cost by improving our efficiencies. We've adopted a lot of technology that allows us to shorten our visits and to communicate information to our lab more effectively. And by doing each of these things, we can give you the best quality, but in a less amount of time, which means less cost to you.
So when we're replacing a full mouth of teeth, one of the common questions that we get is, how many implants do I need, or how many is included in your treatment? This place will do this many, this place will do that many. To make it very simple and to do it the right way, we place as many as are needed. So everybody's mouth is a different size, different amounts of bone is available. That's a big aspect in the planning part of what we do, is really evaluating that. So our cost is based on the final treatment itself. We don't get hung up on, well, what if you need another implant? Or what if you need some bone grafting in this spot or something like that? We will place the number of implants that we feel is needed for the same cost. Sometimes it's 4, sometimes it's 5, 6, but I would say commonly it's 5 or 6 most often. And there are some small variabilities to that, but that's kind of what the average is. And so we're not too hung up on, well, we need to charge you for an extra implant because you really need one in this spot. Nope. we're working as a final product here. We want to plan it as such and execute it as such, and so that's how we attack it here at Revive Dental Implant Center.
One thing to touch on, and it's kind of pulling that curtain back again and explaining what happens on our end and to get inside our heads is, as to how we're planning out these cases. We know that we need a certain amount of distance between implants for success. We also know that there's anatomic limitations. We can't put something into a nerve or into a sinus. And so it comes down to how many implants can we fit between certain things but not having the implants too close together. If you have a small jaw and your nerves are in the way, 4 might be all we can fit for you. But if you've got a larger jaw and your anatomy allows it, we'll go to 6 if that is the best thing for you. If it's more than 6, we'll go to more than 6. But most people, as we've done this a lot, most people are somewhere in that 4 to 6 range.
Teeth and implants are separate aspects of this treatment. The implants obviously are during the surgical process, but the teeth themselves are made separately and they're attached separately. So for that reason, not all teeth are created equal in how they're made in the office that you may be considering. Here at Revive Dental Implant Center, we only make ceramic teeth as final teeth. We do not make acrylic or plastic teeth as a final result for your smile. So we also give a lifetime warranty, and so because of that, we only use the best materials. They're either made from zirconia or a combination of zirconia and titanium, depending on the situation, which allows us to give you a great, strong, life-lasting result for your smile.
We've been at this for over a decade, and a decade ago it was pretty common to use denture teeth for these fixed permanent implant teeth. And that was common, but as technology has improved our industry, things have changed. Now that, in our opinion, is not the standard of care. To us, in our opinion, that is below the standard of care. And we've been through this journey over the last 10 to 12 years where we have seen a transition. We've seen new materials come to the market, and we have literally built teeth in all of the different ways that people are trying them. And what we've learned is that even though I can try and sell you on a cheaper product, you're going to come back to me with problems. And we're done with that. We don't want that for you. We want everybody to end up with the best materials. So we just go straight to that. We're not even going to offer you a cheaper material at a cheaper price. We're going to just say, here's the best material at that cheaper price that somebody else would charge you. And by doing that, everybody's happier. We're happier because you're happy and you're not having problems. So you're not coming to complain to us. And we love to see happy people. So we understand that this treatment is expensive. We know that it's going to change your life and we know that it's worth it. But we do understand that it is expensive and not everybody has the means to jump all the way to the finish line and have the money to do everything start to finish right now. But what we've done to try and alleviate that problem and make it easier is we've created in our office a program called Smile Steps. Smile Steps is a very systematic way of breaking it into steps that are easier for you to handle financially. What I mean by this is that you could have your teeth out and get into a denture and stop there. If that's where the finances are, just stop there and we'll work with you to get to the next step where maybe we're just getting some implants in there. And then after you've saved up some more money, let's make your denture snap onto those implants. Do that for a while where you're saving up some more money, and then we'll take that denture and we'll convert it into a temporary set of fixed teeth. Wear that for a while, again, saving up those funds, and then go into the final teeth. By doing this, by breaking it into easier chunks, you don't have to come up with the money all at once, but you can do it in these steps.
I can't tell you how many times I'm asked, well, if I do this option, can I still get permanent teeth later? Absolutely. That's exactly what the Smile Steps were designed to do, so that we can move through those steps and get to that final product of permanent implant teeth, which is what we want everybody to have.